Hey everyone, Dr. David here. Today we're addressing a serious topic, pancreatic cancer. It's often called a silent killer because it doesn't show symptoms until it's advanced. It has one of the highest mortality rates among all cancers. The 5-year survival rate is only around 12%. Recognizing the signs and symptoms early is crucial. Let's get informed and empower ourselves to take charge of our well-being. One of the earliest signs of pancreatic cancer can be jaundice. You'll notice this as a yellowing of the skin and the whites of your eyes. This happens when a tumor, often located in the head of the pancreas, obstructs the bile duct. Bile, which is produced in the liver, is essential for digestion and normally flows into the small intestine. However, when the bile duct is blocked, this bile backs up, causing bilirubin levels to rise in the bloodstream. Bilirubin is a yellow pigment, and its accumulation leads to the yellow discoloration characteristic of jaundice. While jaundice can be a symptom of other conditions like hepatitis or gallstones, its appearance should never be ignored. If you notice any yellowing, it's crucial to consult your doctor for a proper diagnosis. Early detection is key, and addressing the underlying cause of jaundice is essential for your overall health and well-being. Unexplained rapid weight loss is never something to ignore. If you're losing weight without any changes to your diet or exercise routine, it's a red flag. In pancreatic cancer, this weight loss can be due to the tumor affecting your metabolism. The tumor can cause your body to burn calories faster. It also leads to a decrease in appetite. This reduced food intake contributes to weight loss. The tumor can interfere with the pancreas's ability to produce digestive enzymes. These enzymes are crucial for breaking down food and absorbing nutrients. When disrupted, your body can't extract necessary calories and nutrients, leading to weight loss. If you're experiencing unexplained weight loss, consult your doctor. We all have days when our appetite isn't at its peak, but a persistent loss of appetite, especially if accompanied by other symptoms, is a cause for concern. In pancreatic cancer, the tumor itself can release substances that interfere with your hunger signals, making you feel full even when you haven't eaten. Additionally, the tumor's impact on digestion, as mentioned earlier, can lead to feelings of nausea and discomfort, further suppressing your appetite. This loss of appetite can contribute to the weight loss often seen in pancreatic cancer patients. It can also lead to weakness, fatigue, and nutritional deficiencies if not addressed promptly. If you're experiencing a prolonged loss of appetite, it's crucial to consult your doctor to determine the underlying cause and receive appropriate treatment. Changes in your bowel movements can often indicate underlying health issues. One such change is the appearance of light-colored, pale, or clay-colored stools. This discoloration occurs when there's a lack of bilirubin in the stool. As we discussed earlier, bilirubin is a pigment that gives stool its normal brown color. When a pancreatic tumor obstructs the bile duct, bilirubin can't reach the intestines, resulting in pale stools. Instead, the bilirubin builds up in the bloodstream, potentially leading to jaundice. If you notice a persistent change in your stool color, particularly if it becomes pale or clay-colored, it's essential to consult your doctor to determine the cause. Just like changes in stool color, changes in urine color can also signal underlying health problems. Dark urine, especially if it's consistently dark brown or almost black, can be a sign of pancreatic cancer. This darkening occurs due to the excess bilirubin in the bloodstream. When the bile duct is blocked, bilirubin can't be excreted through the stool and instead gets filtered through the kidneys and excreted in the urine. This excess bilirubin gives the urine a dark, often brownish color. If you notice a persistent darkening of your urine, it's essential to consult your doctor to determine the cause and receive appropriate treatment. While itchy skin can be a common annoyance often attributed to dry skin or allergies, it can sometimes be a sign of something more serious, such as pancreatic cancer. The link between itchy skin and pancreatic cancer lies in the buildup of bilirubin in the bloodstream. When the bile duct is blocked, bilirubin levels rise, and this excess bilirubin can deposit in the skin, causing irritation and itching. The itching associated with pancreatic cancer can be persistent and widespread, and it may not be relieved by over-the-counter anti-itch creams or lotions. If you're experiencing unexplained, persistent itching, it's essential to consult your doctor to rule out any underlying medical conditions, including pancreatic cancer. Abdominal pain is a common symptom of many conditions, but the type of pain associated with pancreatic cancer can be quite distinct. It's often described as a dull, gnawing pain that starts in the upper abdomen and radiates to the back. This pain occurs as the tumor grows and presses on surrounding organs and nerves. The location of the pain can vary depending on the location of the tumor within the pancreas. The pain may worsen after eating, especially fatty meals, as the pancreas tries to produce digestive enzymes. It may also be relieved by leaning forward or curling into a fetal position, as these positions can sometimes alleviate pressure on the pancreas. If you're experiencing persistent or worsening abdominal pain, it's crucial to consult your doctor to determine the cause and receive appropriate treatment. Back pain is a common ailment, often attributed to muscle strain or poor posture. However, unexplained back pain, especially if it's persistent and severe, should never be ignored, as it can be a sign of a more serious underlying condition, including pancreatic cancer. The back pain associated with pancreatic cancer often occurs in the middle or upper back, and it may feel like a deep, dull ache that's difficult to pinpoint. This pain occurs when the tumor grows and presses on nerves in the back, or when the cancer spreads to nearby lymph nodes or other organs. If you're experiencing unexplained back pain, especially if it's accompanied by other symptoms like jaundice or weight loss, it's essential to consult your doctor to rule out any serious underlying conditions. Nausea and vomiting are common symptoms of many conditions, ranging from the flu to food poisoning. However, persistent nausea and vomiting, especially if they occur without a clear cause, can be a sign of something more serious, including pancreatic cancer. In pancreatic cancer, nausea and vomiting can be caused by a few factors. First, the tumor itself can release substances that trigger nausea and vomiting. Second, the tumor can obstruct the digestive tract, preventing food from passing through properly and leading to nausea and vomiting. Third, the pancreas's reduced ability to produce digestive enzymes can make it difficult to digest food, further contributing to nausea and vomiting. If you're experiencing persistent or worsening nausea and vomiting, it's essential to consult your doctor to determine the cause and receive appropriate treatment. Diabetes is a condition that affects how your body regulates blood sugar levels. While there are different types of diabetes, the sudden onset of diabetes, especially in adulthood, can sometimes be a sign of pancreatic cancer. The pancreas plays a crucial role in blood sugar regulation by producing insulin, a hormone that helps cells absorb glucose from the bloodstream. When a tumor develops in the pancreas, it can damage the insulin-producing cells, leading to a decrease in insulin production and a subsequent rise in blood sugar levels. This new onset of diabetes, often referred to as diabetes of the pancreas, may be accompanied by other symptoms of pancreatic cancer, such as weight loss, abdominal pain, or jaundice. If you're experiencing symptoms of diabetes, it's essential to consult your doctor for proper diagnosis and treatment. Fatigue is a feeling of extreme tiredness or exhaustion that's not relieved by rest. While it's a common symptom of many conditions, persistent and unexplained fatigue can be a sign of something more serious, including pancreatic cancer. In pancreatic cancer, fatigue can be caused by a number of factors, including the tumor itself, the body's response to the tumor, and the side effects of treatment. The tumor can release substances that interfere with the body's natural energy production, leading to feelings of fatigue. Additionally, the body's immune system is constantly working to fight off the cancer, which can also contribute to fatigue. If you're experiencing persistent fatigue that's affecting your daily life, it's essential to consult your doctor to determine the cause and receive appropriate treatment. Blood clots are gel-like clumps of blood that form to stop bleeding. They can also form inside blood vessels, where they can be dangerous. Pancreatic cancer increases the risk of developing blood clots, known as venous thromboembolism, or VTL. VTL can manifest as deep vein thrombosis in the legs, or as a pulmonary embolism in the lungs. If you experience symptoms, seek immediate medical attention, as blood clots can be life-threatening. That was a lot of information, but I hope you now have a better understanding of the potential signs and symptoms of pancreatic cancer. Remember, early detection is crucial in the fight against this disease. While the 5-year survival rate for pancreatic cancer is only around 12%, early diagnosis and treatment can increase that rate to 44%. If you experience any of the symptoms we discussed, especially if they persist or worsen, please don't hesitate to consult your doctor. They can assess your individual situation, order appropriate tests, and provide guidance and support. While we can't control everything, there are steps we can take to reduce our risk of developing pancreatic cancer. These include avoiding smoking, maintaining a healthy weight, following an anti-inflammatory diet, limiting exposure to workplace chemicals, and engaging in regular physical activity. Let's spread awareness about pancreatic cancer and empower ourselves and our loved ones to prioritize our health.